evening. You are with the Urban Debate with us tonight, this weekend. Thanks for being with us. I'm Sahar Zaman. And today we're going to take into account the various unlocking measures that have been announced by different governments. In fact, two of the worst hit states that we'd seen of the second wave today announced their unlocking plans. This is pertaining to Maharashtra and Delhi. Well, this is also a positive sign. It means that cases are down comfortably enough to ease restrictions and to have unlocking, to allow people to step out, at least for the essential services and stepping out for work here. But there are also parallel concerns. The fear is to not repeat the mistakes of the past here, to respect COVID-appropriate behavior, to respect the other restrictions that still exist amidst this unlocking. And it is also happening amongst a population which is not yet fully vaccinated. In fact, in Delhi, fully vaccinated population is only 6.2%. Fully vaccinated means those who have gotten both doses of the vaccine. In Maharashtra, the fully vaccinated population is only 3.8% of the state. People in the past have also faltered of what we'd seen after the first wave unlocking. A repeat of that shouldn't happen. We're going to take into account all of these concerns, but first let's get you specific details of what have been announced for unlocking in each government. Let's start with Maharashtra first. Now, this is a formula that has been released by the government. The unlocking will come into effect Monday onwards, so Monday is the big test. It's a test both for the government and for the people to respect the unlocking measures. Starting 7th on June, this is based on positivity rate of each district, parallel with the figures that they will release, that they will receive as far as beds and oxygenated beds are available. Basis that unlocking is going to be done. And in fact, these are figures that would be revised and revisited by the government every week. But the government says that districts and cities are to fall in 5 categories, from level 1 to level 5. And Mumbai, in fact, falls in level 3, implying non-essential services there will be allowed to open up, but with restrictions. Let's also get you what the Delhi plan here is. The Delhi Chief Minister, Arvind Kejriwal, in fact, made this announcement earlier today here, saying the resumption of metro services, which is to start, but this is only going to be with a 50% capacity, and other public areas such as malls and markets, they are to be opened up in what is the favorite formula of the Aam Aadmi Party, which is the odd even. So basis on the odd even formula, markets and malls will open up here as well. But because we're looking at a pan-India view, let's get you other announcements that have been made by other states here as well. Tamil Nadu has eased curbs in 27 districts. Gujarat has decided that private and government offices are to operate with 100% staff. Bihar says relaxation is related only to trade-related activities. That's a specific relaxation for the state of Bihar. In Madhya Pradesh, government offices will operate now, but with 50% staff only. Places of worship, though, are to reopen. And in Uttar Pradesh, there are relaxations across the state, except 20 districts. These, of course, would be the worst affected districts, which are still looking at higher numbers. So what we're asking tonight here, while I throw this open to our panelists tonight, are the risks involved in unlocking this time, unlocking post the worst of what the country has seen, the second wave of the pandemic. And how is this going to be different from the unlocking that we've seen from the first wave, the big takeaways and the learnings that we have from the past year? Let's throw this open. We have Captain Shalini Singh, spokesperson of the Aam Aadmi Party. We have Mr. Clyde Crasto, spokesperson of the NCP, and Dr. T.P. Lahane, who's the Director of Medical Education and Research in Maharashtra. So I'm going to go to the expert voice first on this, the medical expert voice here with us, Dr. Lahane. All of you, good evening. Thank you for being with us here. But first to you, Dr. Lahane, the biggest concerns and the biggest fears in your view, because we've gone through the whole cycle last year of a lockdown, of gradations and unlocking, and then when all restrictions were thrown out and people were out, people weren't following the COVID-appropriate behavior either, and state governments had dropped their guard as well. What are the concerns for you today as we take into account new unlocking measures announced by different states?
See, the what measures announced by the Maharashtra, it is a 5 stages the lockdown is to be released. And in that, if you will see, we have made the 5 steps. And in the 5 steps, if you see, it depends on the percentage of the positivity and also the percentage of the oxygen bed where the patients are. Now, why we are unlocking? See what happens today. If you see in the districts where the percentage of the positivity is reducing, secondly, number of the occupancy where in the ICU bed is also reducing, and after this, we will have to open few districts where
Yes.
the percentage is reduced, and because of that, I think okay now the this will happen, but we will have to be the all the citizens, they should also, I think they will have to really observe the COVID appropriate behavior. Otherwise, what happens again, like that in April, we went for the lockdown, and if the number of the cases increasing, we will have to again impose such type of lockdown. And so the COVID appropriate behavior by the citizen is really the essential when we are now going towards the lockdown, opening the lockdown.
Clyde Crasto, in your view, is this more of a litmus test Monday onwards, starting from Maharashtra here? A litmus test more for the government or for the people?
I think
Now,
from day
this
one,
must.
from day one, when this pandemic started, I've been doing a lot of debates on your channel, and I've always maintained that, this whole thing can be brought into control not just by the government, but with a lot of help from the citizens also. So if you look at it this way, when we went through the first phase, when we were coming out of that, people actually followed all the norms, all the COVID appropriate behavior, everything was followed very well, and we brought this down. I mean, sometime in this year, in January, February, Mumbai, if you see, the cases had gone down to only just about 250 cases in a day. Maharashtra also had come down drastically to about 2,000-3,000 cases. So basically, people got together along with the government and helped the government to bring this down. Then at some point, when the relaxations came up, people started sort of taking it lightly, and they thought maybe we are out of the woods. But we were actually not out of the woods, and that's when the cases began to rise, and then we reached to the second phase, which was really, really bad. And now, slowly, if you see, with the lockdown in place and people actually following the behavior of the COVID-appropriate norms, we brought it down again. I think this is a test, yes, a test for the government, a test for the people, but the test is together. We have to work together to make sure that we bring this down even further. Because from Monday, if the lockdown opens up, the curves are there in place. Some places 50%, some places going to be more. Different phases, in different levels. People will have to follow all the norms, and I'm sure we can do it. If we have done it before, why not now? So, having looked at it this way, that yes, there are certain times when we've gone out of hand. But we can still do it, and looking at what the experts are saying, that there's going to be another kind of wave that is going to come in. I think we need to be very careful. We need to put this down together, our heads together, and make sure that we do not take it lightly and fight it together. That's the only way to come out of this.
Captain Shalini, in your view, is there a daily analysis that needs to be done by respective state governments this time? Earlier, when we'd seen unlocking happening, there were restrictions eased to the extent that relocking in certain districts, in certain areas, was very delayed despite the rise that was being noticed. I mean, this is how we've studied how the second wave hit India in the early few weeks of May, and how we suffered through the month here and saw the worst of the pandemic here. What is going to be the state government's job? Let's look at Delhi government here in a daily analysis, or far more of a scrutiny on a daily basis of what we had not seen in the first wave. Our learnings from the first wave unlocking to be used this time.
Good evening to all of you. Definitely, I think if we don't learn from this time, we will never learn. So last year, what we saw was, I think, a very little part of COVID, and this time in April and May, what we saw was really scary, and a lot of people have lost their family members, and a lot of people uh, got very critical and came out from deathbeds. So even people are very scared this time, and they are supporting the unlocking phase also. So there is no rush this time in Delhi that open the lockdown. We our business should get back. We should go back to offices. So what we have observed that there is no such hurry among citizens. Also, they are much aware and scared. Now, once we come back on unlocking from next week, that is Monday, it is extremely important that a daily analysis of every day. The COVID testing will be done. We will increase our COVID testing. A lot of COVID test camps are being put every day at multiple places all over Delhi by Delhi government free of cost. So we are going to increase that so that people who are coming out, we are testing them regularly. Because as of now, vaccination, not everybody is vaccinated. As you told that less than 6% and 3% in Marahstra people have been vaccinated. In Delhi, only 12 lakh 69,000 people have got second dose, and vaccines are also giving
Yes.
70 to 75% of safety. So it is very important that we keep testing, and also it is important that everybody should follow the norms. So that is why it is being rolled out in a very phased manner, that even if the markets are getting opened, it is not that all entire market will open. It will be a pattern of odd even
Okay.
will be followed. Even the market associations have welcomed this step, that
That's
they
right.
are ready to follow. So and so now, as we see that
Okay,
this wave is going
because
to go,
there were also reports here saying that the Delhi traders are telling the government here that they have suffered huge financial losses since the past 1 year. They're putting amount of pressure on the Delhi government here as far as Delhi traders, those specifically belonging to the automobile sector here as well. That you need to be thinking of the economy. So to what extent are you willing to listen to that, but not get into a compromise, to be compromising the health of the larger state?
as he definitely said, it is important to understand that we cannot, complete lockdown shut is definitely hitting the people in financially. And that is also one field where everybody is struggling. People have lost their jobs, business people are out of business. So, keeping all these things in mind, this decision has been taken because we are fearing the COVID third wave, which is definitely going to affect children, and that is very scary. But at the same time, we can't just keep sitting and keep shut everything till we see the third wave, because nobody knows when the third wave is going to hit us. So it is so this unlock in phased manner is that why we are doing, and we are not opening the schools, we are not opening any recreational things like cinema halls are not being open, gyms, saloons, spas, these are not being open.
Okay.
uh, so restaurants are not being open. So these things are going to take care. Also, we completely respect the sentiments of traders association, and that is why in a phased manner this has been opened after discussion with them. It is not that it was a monologue, it was a complete dialogue established by the government with the trader association, and this was the decision which was made, and that is how this unlock was decided.
Right. Clyde, what are the concerns of the government of Maharashtra here? Apart from people's demands, we'd seen in phase one, of course, demands that came in from a certain set of people, demands that came in from the state opposition as well, in pushing the Maharashtra government to reopen places of worship, places that do see mass gatherings. But you've also, in this very elaborate unlocking plan that you have with level 1 to level 5 on different districts have been categorized into different levels here. What is it that the Maharashtra government is going to keep foremost in mind to not be repeating any mistakes of the first wave unlocking? One thing that needs to be followed in this second wave of unlocking.
See, what's going to be foremost on the mind of the government is the safety of the people. And that's always been the prime important thing that has been on the mind of the government. You have to think about the safety of the people. Now, the question is about the opposition. I mean, in Maharashtra what is happening. The opposition has been, doing what they are doing just for the sake of doing it. Now, the fact here is the government has to balance it right. We have to remember one thing. The financial aspect is one aspect there, and the other side is the safety and the health of people. Now, you have to draw a line between the two and then go accordingly. Now, if you're going to open it up with the demands from the opposition, just saying that finances are down and the economy is down, yes, it is down. But at the same time, are you going to jeopardize the health of the people by just looking at the financial? If you carefully look at the way Maharashtra government has been working, it has not announced anything just off the cuff. Overnight at 8 o'clock, okay, now there's a lockdown. We have gone, treaded carefully, looked at every aspect carefully, and then opened up things. Yes, we need to look at the financial aspect because people are suffering. People have lost jobs. People have lost their income. Everything is there. But at the same time, people have lost lives too. People are dying too. We have to look at both sides. So I think the Maharashtra government has been balancing it very well. I mean, Dr. Lahane is right here. I mean, he's a very senior person and he knows exactly what I'm talking about. So we have drawn the line. We have balanced it properly and things are opening up. Now, one more thing I want to tell you. You've been talking about vaccination and the vaccination has been less in Maharashtra. Everybody knows what has been happening. We are getting less vaccine doses in Maharashtra. You look at the caseload that we've had, look at the population that we have, and according to the caseload and population, look at the amount of vaccine doses that have been provided to Maharashtra. 1st of May, suddenly the center says that, now we open it up for 18 to 44 and you start vaccinating on your own. And then when we go to the vaccine company says, we do not have because we've given all the stock to the center.
So this is, of course, on what the state governments are also expecting from the central government in support in these unlocking measures here. Dr. Lahane, would you like to step in at this point on what the central government, what the central government needs to do in going along with state governments on their concerns? One, of course, is the vaccination supply. The other is, of course, sharing genome sequencing data much faster. We had not seen that happen, which is why the second wave hit us in this manner. The central government did have a certain amount of genome sequencing data on the double variant here, but which was released much later, which, I mean, for the worst affected states that we had, Maharashtra and Punjab, that were facing those cases here. So what is it for the central government here to do as well? While individual state governments are announcing their unlocking measures, what should come in from the center?
See, from the center, first of all, as you have seen, the supply of the vaccine should be regularized. And that is very, very important from the central government. Secondly, about the genome sequencing. The central government was doing the genome sequencing only the 10 districts of Maharashtra. But that was not essential because last time we have seen in Amravati, we got the mutant, that is double mutant. But to know this double mutant, 1.5 months was passed away. And because of that, now the Maharashtra government, now with the we are doing the genome sequencing of all 36 districts. And what is required is minimum 3 to 5% of the cases where we are making the genome sequencing should be done. And that we are doing so that we can keep on watch where the we are getting the mutant. And then in that districts we can plan for the, you can say, lockdown, or we can take care of that districts. So whenever we are opening the lockdown, we require to trace important. See, tracing of the cases and you can see the testing and tracing is very important. We'll have to increase the tracing and testing that we are doing, and secondly, genome sequencing.
Okay. Captain Shalini, talking about Delhi government here, this is, of course, with respect to testing, tracing, with respect to genome sequencing here as well. In the midst of this unlocking, while a large number of population starts to step out again, what is the Delhi government's preparedness here?
So, keeping what we had seen in the second wave, we all were caught unaware at many places, and we saw something which I think was very unfortunate. So this time we are not sitting back and waiting for the third wave to come, and then we are running here and there. So there was a peak when in April, May we saw a peak, and the highest peak for one day was 28,000 people got infected with COVID. And keeping that peak in mind, there is a figure of 37,000 which government has zeroed on, and we are preparing for the third wave, keeping in mind that on one day 37,000 people might get infected, and we should be ready for that. Also, if more than 37,000 people are getting infected, we are prepared for that also. Now we are also making a oxygen storage capacity of 420 ton. IGL has been asked to make to install a plant for 150 liter of oxygen capacity. They said they will take 18 months, but we have asked them to start so that we are prepared, because we are not aware till when COVID is going to stay and till when we have to be part of this pandemic. Also, this in wave, the worst was what we saw was that the transport of oxygen from one place to another. That was the worst thing which we faced. Even if we are getting oxygen, we are not able to transport it from place A to place B. So, keeping in that, 25 cryogenic
Right.
tankers have been ordered by Delhi government. We will be keeping it for us. And 64 oxygen plants are also being uh, made by Delhi government to in the third wave. Also, pediatric
Okay.
task force has been established for the
All right.
children, because on the third wave we're seeing the third wave is going to hit children. So equipment for children for oxygen beds are being made, and identify the ratio of oxygen beds for children and adults. That is also being done, so that children are also being taken care of, and adults are being infected, they are also being taken care of. So this time, I think Delhi government is far
Right.
more prepared, and in the process of not being caught unaware. I will definitely say that. And surely we need vaccines from the center, because we have to increase the pace of vaccination also, and like we have to start vaccinating our young population also, like 12 plus or below 10. Everybody has to be vaccinated. I think that's the high time we should start working on
Yes,
that.
and a lot of state governments, of course, saying that procurement system needs to go back to the central government here. Clyde, I'm sure you want to speak on this, but while you respond to this entire, as many would say, mistake that has been made of the past 1 month of decentralizing it, asking states to procure, farmer giants coming back and saying that they don't deal with state governments, they only deal with central government here. So perhaps the procurement that needs to go back, the entire system of procurement that needs to go back in charge of the central government here. But also a word for the people, and this is with respect to what we'd heard from the Chief Minister say just a couple of days back on the number of traffic now that is being seen as unlocking measures are being announced here. What's the message for people here as well, that if it's unlocked, do not step out uninhibitedly, indiscriminatory in this manner?
There are two things I'd like to address here, since you asked me. One is the vaccine policy. The vaccine policy has been flawed from day one. When we needed vaccine, our vaccines were sent out in the name of vaccine diplomacy. And our representative in the UN also said that, we've given out more vaccine than we've vaccinated people in a country. Then, when they realized that we were going to fall short of vaccines, the central government suddenly decided to ask the states to, provide inoculation and vaccination to their people on their own terms. The point here is, if the central government would provide those vaccines, it will work out even better, because there should be equal and fair distribution. You charge the states are willing to pay, because all the major companies, be it Pfizer, be it any other company, Moderna, they all have been saying that we are not going to deal with the states one-on-one, we are going to deal with the center. So right now the situation with the states is that if we have to inoculate our own people, we have to be at the mercy of the vaccine producing company. And those companies are willing to only deal with the center. So you are at the mercy of the center. So the whole vaccine policy has been flawed.
So that is, of course, vaccination concerns here. Second, Clyde, yes, you've established that problem.
People.
The second concern, of course, is people stepping out in large numbers, and how do you control that? How do you maintain that? Go ahead.
Like I mentioned before, Sahar, it will only happen if the people work with the state, hand in hand. We have to do this together. It's not just the state or just the people. They have to work together. My humble request to all the citizens in Maharashtra and the country is to follow the COVID appropriate behavior, follow all the norms, because it's for your good. Because if you're not going to follow those norms, the cases are not going to come down. I mean, every day we have a new mutant coming, a new variant coming, and if we are not going to follow the behavior, it's going to be trouble for all of us. So we have to follow. I mean,
Right.
how many
Yes, and one would think that amount of precaution now is well understood by people. Dr. Lahane, do you think this time it's going to be very different of an unlocking phase here, because people have also understood as much? Final point to you here, Dr. Lahane, for tonight, that people have also understood as much, and perhaps we are going to be seeing much more respect for COVID appropriate behavior amidst this unlocking now.
I think when we are unlocking, I think I really want that all the people should behave in the COVID appropriate behavior, and that is very I think essential, and that is for their good. And if they will not, I think they will not follow this COVID appropriate behavior, then I think again there will be we'll have to go for the locking system, this one. So I think before that, if they follow the all COVID appropriate behavior, and my request to everyone, see that I know that because this from 15 months you are following this, you are tired of the COVID appropriate behavior. But see, after 100 years this came, and after 100 years we are facing the epidemic. So in pandemic, I think important thing is that our lives, and our lives are important, and because of that we must use the mask. All I think using the mask, it should be like a clothes. As we are doing the clothes,
Okay.
so it should be made an integral part of the
Right.
clothes mask. And if they behave like that, I think we can definitely work, and the unlocking will also work. But it should be together with the government. Government is taking all the
Absolutely.
precautions, and
Yes,
also
the confidence here. Yes, Dr. Lahane, I'm afraid we'll have to leave it at that. Appreciate everyone speaking with us here on this. But the confidence here is hopefully that everyone's learned this the hard way. And we are going to be respecting the unlocking measures, the fewer restrictions that still exist amidst the unlocking here. We've seen the worst of the second wave, while we're bearing in mind that there could be a third wave. But perhaps in being responsible here, we could fight off the very coming of the third wave itself if we continue to go hand in hand with the state government. The central government continues to take into account requirements of the state governments here in this unlocking. Thank you for being with us here tonight.